Okay. So hello. Hello everyone. My name is Dr. Hadiza Osuji, and I'm the Executive Director of AICC, African International Collaborative Center. AICC is a nonprofit multidisciplinary organization uh, established for the charitable purpose of promoting and preserving African culture and ethnic pride, empowering African women and youth for success, building leadership among the members and the African community at large, as well as collaborating with organizations, including faith-based organizations, community-based organizations, institutions, to develop and implement programs that are culturally and contextually relevant for the African immigrant community. And of course, we're based here in New York, specifically the Bronx. So this is the first day one of our AICC speaker series. And with us today, the speaker for the series this afternoon is Dr. Nelson Aluya. Dr. Nelson Aluya is a physician at the Newark Beth Israel Medical Center. He's also an assistant professor of medicine at the New Jersey Medical School, Rutgers University. So Dr. Aluya we're gonna, through the physician lens, we're gonna talk about, he's gonna speak about his experience, and challenges working in the front lines, of course, during the COVID-19 crisis, and he will touch on, vaccines. I'm sure that is an issue of concern right now as we are going through the healing process, the readjustment process, and also he will touch on, returning to school, because we're getting to the fall semester here in New York, and students are getting ready to go back to school. And what does that translate? I mean, what is the implication of that? And also, he's going to provide suggestion, for future consideration. Without further much ado, I am going to hand the floor to Dr. Nelson Aluya, who will begin by telling us, speaking about his experiences and challenges as a physician, right, working in the front lines. Dr. Aluya, you are welcome.
Well, thank you very much. It's a pleasure to be here and a great honor to, you know, uh, be in your presence and the opportunity to be able to speak to your audience about one of the things that has become a nightmare, not just, health-wise, economically, socially, and even emotionally, as well as spiritually, has affected every facet of our life. Is the greatest health event that's happened in the last century, and it's going to be here with us. And who knows for how long and how much is going to affect our lives even worse. So it's a pleasure to be here. Thank you.
You're welcome. Yes. So yeah, go ahead and please, share with us your experiences, and challenges working in the front lines, as a physician.
Well, this whole thing, I mean, late in November when we had what was going on in Wuhan, China, and then all the deaths and the things that we were seeing, which was very unique. It was shocking, and it was very disturbing at that time. However, because we hadn't seen anything like that, we haven't felt anything like that. The COVID-1, which is the SARS and the MERS that took place way back in Southeast Asia and China, just barely breezed by. So we weren't really prepared. And then when it actually began to come into the country, and then really hit New York and New Jersey. I work in New Jersey, and it almost took everybody by surprise.
Absolutely.
in as much as we heard what was going on, and unfortunately didn't really learn from China what was going on and how they fought the whole thing. When it came, it was like helter skelter, and then we had to make adjustments and, provide, options and stuff like that we needed to protect ourselves. So, in the whole process, our practice changed. We shut down the clinic, shut down every clinic, started moving patients, around in the hospital as the numbers, of infected patients were going on the rise. And of course, not just the ones we admitted that were coming to the emergency room, who at that point in time, signs and symptoms we had to, learn as we go, you know. And then, of course, those who were coming in sick and had to be admitted in the hospital. Of course, they had patients in the hospital, so we didn't want to get them infected. So we had to rearrange the whole hospital structure, the management. Everybody's hands was on board to get this done. And then those who were really sick. I mean, most times, most hospitals have capacity for great hospital capacity of 30, 40, 50 ICU beds. But when you have 50 people coming in at a time and they're really sick and you needed to keep them and intubate, then it became a big issue. So we had to find ways of creating other ICU units or step down units. And unfortunately made harsh decisions about who, to prioritize, you know, and create avenues for those who were really sick and how to take care of them, basically well. And basically the word is triage, to triage them, who's the sickest, who most likely will die, who most likely will recover, and all that like that. And of course, then we had to move patients, the staff, those who were in outside outpatient clinic, um, to come in and help with the residents. And all residents at this time around were on board. It was predominantly an adult disease, but then we had pediatric residents, people in radiology, people who were doing other forms of specialty to come in, surgical residents to come in and help in management of patients under the care and guidelines, of course, of those in medicine and the senior resident. So, and that's how it was. And then the clinic were closed. And of course, as doctors who were taking care of patients, you were exposed, and we have spouses who were exposed. So we got sick. I got sick myself, and I was out for 3 weeks. Um, in fact, I think I've never been sick that much in my life. And people ask me, how do you describe it? I said it was like having the flu and malaria at the same time. For those who've had malaria, they understand what it is. And then if you've had flu, putting both together at the same time, that's how it felt. And the worst thing that happened was the profound weakness that came out of it. I've never seen anything like that before. Before I got sick, patients of mine used to describe it as the as a sleep of death, where you get so weak to a point where you just want to do is sleep and nothing else. And that's where people really get sick and die, because of course, again, it was a respiratory problem. People who got sick, had respiratory problem. Most of the people who died at home died alone. Most people who lived alone. So all that, emergency management and all the whole thing that we did. And of course, when we got back, we had to do telemedicine, because there was no inpatient clinic care. And then in the hospitals, there were no surgical procedures, only strict medical emergencies that were, unavoidably um, needed to be done, that were the ones that were being done. So we're still in the process now. Things are slowly coming back into, settling down and looking better here in New Jersey and New York. Things are a lot better. The incidence rate is much decreased. The death rate is much decreased. Hopefully, knock on wood, like they say, it shouldn't rise again. But then those in the South, Florida, Texas, and then California, I guess again they understand what it felt like to go through what we in New York and New Jersey went through. Until you go through, you never know. And in all sincerity, it's hard to really prepare for a virus that's this contagious. So telemedicine is here to stay. We've always thought about telemedicine, and some people were shying away from it, even physicians and and patients. But now it's an option. So it's a blended medical practice now. You do a lot of telemedicine, and you do, you know, an in-house medical management, of course, with all the measures to take to protect ourselves: social distancing, washing hands, wearing face masks. That's what we've been doing so far. Yeah,
Wow.
great impact, great impact.
Yeah. So, and do you think that telemedicine, how is it impacting? Is it like working? Is it something really that you think is here to stay, moving forward? Or are we really going to go back to the, physical um, meetings, in the hospital?
Well, I say it this way: it's almost like when the cell phone came.
Yeah.
Some people were against it, and some people thought it wouldn't last. But guess what? It's here to stay. This is the
Yes.
life we live now, and it's a
Yeah.
life of convenience. In all sincerity, a lot of the times when you see a patient and you ask them to go do blood work and all that, they have to come back again to sit with you and discuss the results. And a lot of patients who are really old, it's inconveniencing to do that.
Yeah.
So with telemedicine now, just like you and I are talking, we can talk, we see each other, we review the results, and we just talk. So but thank God the government, the CMS, which is the body that controls reimbursement for doctors as they take care of patients, has made it possible for us to get the adequate amount of reimbursement when you see patients online as
Mhm.
compared to when you see them in person. So
In
it's really
person.
convenient, especially for elderly and those who have problems with transportation, because it's huge, and some of the ways, the reasons why some of us don't have access. I mean, when I mean some of us, those in the indigent community or black and brown community don't have access, to transportation or coming in to the clinic. Because I make it a point of habit to always ask my patients, "How did you come in today?" You'd be shocked. Some of them took 4 or 5 buses, to come in. And as us who are doctors, we should be passionate enough or compassionate enough to take that into cognizance, so that when they come in, and sometimes they even come in late, you don't have to kick them or send them out. You're late. No, especially if they're elderly, you have to, like, oh, okay, you took 4 or 5 buses just to get here alone, and the bus may have been, late. Something happened, and that's why they're late. So if they're there, we'll take care of them and we'll see them.
Absolutely. Challenging times indeed. And could you share just briefly, how were you able to recoup, from the ailment, like when you were sick? Now, what really helped you? Because like I can see, of course, you bounce back and you're healthy, and nobody will look at you and even, think that you've gone through, yeah, gone through that
So it's
trauma.
a whole lot of support,
Yeah.
support from family.
Okay.
Like I said, those who died at home, a lot of them died alone. Majority of them died alone, and I heard a lot of patients, who went through that, friends of friends who went through that, who lived alone. So for mine, it was family. The wife was there, and of course my daughter, who, with the social distancing, and mother-in-law, they cooked food. I was what do you call it, sequestered into a particular room. I didn't leave the room for 3 whole weeks. So they made sure they brought food to me, and make sure that I ate and drank much fluids, and and those were the huge support that makes a lot of difference, because that fact of you just wanting to sleep alone and sleep all the time. I mean, there were times I could sleep for 20 hours, I swear. So and that's, they just wake you up, you eat, you go back to bed, you know.
Probably is the much needed rest in addition to the,
I know. I mean, for someone like me, I tell people this, that I'm always on the go. I
yeah,
barely have time to eat, and or even rest or sleep. But when COVID came, I was doing the opposite completely. I was sleeping too much, resting too much, and then surprisingly, I was eating a lot, which was really surprising. And then I didn't feel like holding my phone. Everybody knows me on my phone, but
yeah,
the phone, I hated the phone at that point in time. I just wanted to sleep. So, and all that. But then
yeah,
some of the things I actually did when it came to medication, because it's been a huge issue now.
yeah,
Now, at the point when it came, it was, we threw everything at COVID except the kitchen sink,
yeah,
like we say. And before the whole thing came up, a lot of my patients are taken care of, elderly, multiple, heart disease, kidney disease, and all that. But one of the things that profound I asked them to do, and which I did myself, was I got the Vicks. I boiled the hot water, put the scoop of Vicks in, rub on my chest, my back, all over my face, and then heat it up, and I did that 2, 3 times a day. And that really did help because it goes on to clear your airways. Because there are times I felt, a little bit of shortness of breath and all that, and I knew something was beginning to take place. So I did that. And before I got sick, I'd asked a lot of my patients to do that as well, which they did. And thank God, I didn't lose anybody. Nobody died. No patient of mine died who, had
Wonderful.
the COVID. Now, in between, in terms of medications, it was the azithromycin, the vitamin C, the zinc, and of course the hydroxychloroquine, which was the only thing we had then. They took, and was it the medication that did it? Hopefully, or was just God's grace, or but particularly what I felt was really helpful was the airways protection. That heating and steaming up was really helpful. I
Yeah.
had written something about it then. I shared that with my whole community just to help them out. Now I did that. Did I take the medications? Yes, I did. I did the Zitromax, the whole stuff, including the hydroxychloroquine. But for me personally, it would take away the fever because the fever would just it was what they call the step ladder fever. 100, 101, 104, 101, 102, 10. You understand? So, and
Yeah.
that's how it just kept on, going. So when I take the hydroxychloroquine, I feel the fever will go down, but then it'll come up again even higher. And it went on for like 3, 4, 5 days. Of course, the only other thing that I had at that time, which I had actually used for some of my patients as well, was mefloquine. And I took, it's usually, the way you treat malaria, but this way you take two tablets of 250 and two tablets of 250 again. And as the day I took it, that was it. The fever went away till today, and I've never felt stronger.
Wow.
Um, and that's what personally I felt did the magic for me because understanding how hydroxychloroquine work, it needed the zinc. I didn't have the zinc, but I just took multivitamin. So was that the reason why it wasn't helping? Probably not, or yes, I don't know. It's still the jury's still out there. um,
Yes.
that's what we did. And of course, one of the things I did again was I still kept my exercise no matter how tired I was. I have
Oh,
to take a shower, because the fatigue is profound. Like I said, unless you go through it, you never understand it. I did my daily exercise I usually do. Everybody who know me, I talk about just before I took a shower. Every day I took a shower. Every time I did the exercise, stretching out, just to
wow.
not.
How were you able to get the strength to do the? I can imagine even when you're sick, the last thing to get out of bed, it's
Right.
something. Now to do, to do the exercise, that's another level. Now, how did you come about? How were you able to do that?
Well, it's something that's been imbibed in my memory,
Oh,
in
it's
my
already
brain every day. I
in the
exercise every day.
genes.
But I tell people I'm lazy. They're like, "Oh, you lazy?" I'm like, "Yes," because I can't not go to the gym. I'm sorry because I barely have the less time and all that. So, but before I took a shower every day, no matter how little the amount of time that you have left, just do something. And I always tell people this: let the heart race once, at least once every day.
Mm,
As you getting ready for your day. You're in the bathroom, you can put your hand on the wall, push like we push cars in Nigeria when the car is broken down. You push the
mhm.
wall and then just jog and run. And for me, I count to 200 and I run. I do that, and I put my hand on the wall. I squat. I started with 15. Over the years, I've graduated. I do 200 every day. Stretch my legs.
200.
Yes, every morning.
Okay.
And that's what I do every day to keep me going, to keep my heart going. It makes a whole lot of difference. It gives you the reserves, um, muscle wise, blood wise, mentally wise, and the mentation as well.
Okay. Oh, wow. Thank you. And also, I just before we round up this part, you had mentioned your daughter. I'm just curious. Now, how did this whole, episode, how did that, impact her?
Well, for those who know me, they know me. My daughter is always with me wherever I go. Even when I go give my talks or do my community service, she's always there with me. Stephanie is her name. She's actually going to college tomorrow, so I'll be missing her so much. So
Good.
she's going to New Haven, Connecticut.
Oh,
Uh, but fortunately, or unfortunately, I don't know what to say. She's going to do law, not medicine. So even biology and physics, she's going to do law. So, but I wish her well, and a lot of people who know me have wished her well. So, um, she understands what it is to be in a home where the father is a doctor, the mother is a nurse, so she understands that. She was very sympathetic to our plight, concerned, and
Mhm.
of course worried. Understanding what she's seen on TV and all the things that have been going on around the world and on social media, and people dying and all that. So she was concerned, but she didn't try to show it, and she would help grandma cook and bring the food, and whatever we need. Um, she'll bring it up, but I know she was concerned, but she didn't really want to show it.
Oh, great. I
But
see.
thank God she didn't get sick.
Exactly. That is great. And thank you for sharing that, Dr. Aluya. And now, just like you mentioned, if you can touch a little bit on vaccine, because it is a concern right now, for those who have gone through, like you had mentioned, unless you go through it, you can never truly understand. And those who haven't, and there is the fear of, listen, is it coming back, right? You other cities now, we see it coming back. And kids are going back to school, right? So, and the vaccine is still not available. Can you just share, with us, from a physician point of view, what really should we be thinking about, with regards
Well,
to the vaccine?
yeah, sorry. In all sincerity, like I said, it's here and it's here to stay. The WHO actually just came out yesterday to say that they think the coronavirus will be over by in 2 years.
Okay.
I know a few months ago, even in March and all that, people had asked me the same question, and I said, look, in all sincerity, um, the time most people stop worrying about this, we're looking at about 3 years, really. It has to be about 3 years from now before things really begin to go back to normal. But the question is this: would we ever stop wearing masks? The question is yes and no, because down the road, a lot of people feel comfortable enough. No more reports, nothing on social media. The news circle must have shifted to something else, and then people feel comfortable to walk around, without anything, the mask. But with people completely stop wearing masks, not everybody. A few people still wear masks irrespective. I remember when I used to travel around, international flight wherever I go, I see, those of Asian descent put on mask. I used to feel a little uncomfortable, like why are the scared putting on mask? What
Kind
do
of
they think I
scary
don't know?
too.
But then now we know what they know and
Hmm.
understand what they've been through that we never knew before. So, but of course, again, when you fly, I'm sure most people will still wear masks, or if they go to places where they're not sure of what's going on, or the people who are going to be there, people wear masks. So, but I mean, people tend to draw inferences to um, the 1918 virus that took place when 15 million people died. But the difference then and now is we have so much technology. At that time point in time, they had no vaccines for technology. The world was not as aware as what it is now, um, and information that travels around and how to protect yourself and all that. We were here. We saw what's happening thousands of miles away in China. So we're a lot more aware. We're a lot more cognizant. There's technology. There's chemicals to keep your hands, clean and all that, wearing masks and all that. Now, but those are huge advances to us. I remember when I read something how the virus actually came through, Europe, through Ghana and then into Lagos, and then by how it spread all the way to Calabar, and it took a span of about 10 months before actually when it got into Nigeria, before it got to Calabar, because transportation was longer. It was times were tedious, but now it's a whiff. Within 6, 4, 5 hours, you're wherever you're going to.
Hmm.
So, basing that dynamics of what happened then to today, where they talked about the second wave and all that, but we haven't really seen the second wave. The reason being that, then people didn't travel as much, and when it was winter, people traveled less. But now people travel all through the year. So we expected that in summer it will go away, and then in winter it will come back. But that's not what we're seeing. And that's because people travel and the contact is so contagious that people expose this thing, and we're seeing it all through the year. So it's going to be endemic with us, and that's the way it would look like. Now, the question is, with the seasonal flu and the winter period coming, would it be worse? Would more people die? I mean, with winter back in the for generations, with the flu, 30,000 people die every year in this country. But then that's 30,000 people who die, um, that wearing mask. So this time around it'll be a little different because people are wearing masks.
Mm-hmm.
So the flu and the exposure, which is not as contagious as the coronavirus, will not. And I propose, and I can swear and clap my hand that it will not be as bad as it used to be in previous years. I'll give you a typical example. If you live here in the United States, you know what it is. $2 billion is spent on allergy and allergy medications every year. This
Yeah,
year, what was the allergy season like? It wasn't that bad because
yeah.
people wore masks. So I know how much I used to spend every year on the flu,
Allergy.
and on the allergy. But
Mm,
this year I barely spent anything because we wore masks all through. So most likely, the flu virus will not be as bad because most people will take more precautions. There's of course social distancing again, and then the wearing of the mask. So um, that's what I think is going to happen.
oh, wow. Okay, sounds great. Thank you. And also, if you would like to, you just mentioned now Stephanie is heading back to school.
Right.
Actually, and I have my daughter too heading back to Buffalo soon. And the younger was preparing to go back to school. And there is this debate whether they, I'm thinking whether they should go to school for the full time or they should do half schooling at home, half school, physically present in school. And so that issue and that concern has been going on. Could you just share from a physician and a parent's perspective,
Right.
right? What are the concerns and really what should we be thinking about?
Right. Well, of course, I'll put this caveat in here. Of
Yeah.
course, the kids are tired of seeing your face already. I'm making them do home chores. Get me water. Clean the house. And they're tired of that already. So they want to go back to school. And of course, hanging out with their friends and all the social things, that they
Exactly.
do, which is part of their development as well.
Yeah.
And these are some of the things that we must take cognizance of. How our kids, this generation of kids, what would they look like 10, 20 years from now? What are the emotional, psychological, trauma they sustained
Mhm.
with this emotional, outcomes that they will have, being locked up in one place for months, and, restricting their movement. Kids are like birds. They want to fly. Once they grow those wings, they need to spread them. But now, socially, politically, otherwise, we're not letting them spread their wings. And
Mhm.
of course, there's the reason of fear. Um, you know, Parents are afraid and they show it all the time. But a lot of the time, we forget to ask how the kids feel. What are they going through? What's the emotional stress and turmoil they're going through? And I think this is one part that parents should take notice of, take responsibility as well, and then share with your doctor, as well, and with the teachers, of course, and form social groups, support groups, where we begin to talk about these issues and the things that come out of this. The parents who were sick for 6 months or more, ICU and all that, those are traumatic. When they come out, the sequelae of the disease, the financial burden on the disease that even affect the kids, we're not talking about those things. And I think those are some of the things that need to be brought on the table to discuss. And this is where psychiatrists and psychologists will have to play a huge role. Now, coming to the aspect of school, I'm a pediatrician as well as an adult doctor. So I see kids and know what they go through and what they see, and of course I'm a parent. So from the physician aspect of it, um, there's a whole lot of political issues going on. The pull and the push, with regards to going to school, and opening up the system. And,
Mhm.
like I had written one time, there's no, simple grounds on when it comes to the corona and the economy.
Mhm.
We just have to find, you know, a reasonable, rational, place where we'll discuss the point of saving lives and livelihood. And that's where it's important, and that discussion has to take place on every level, in every home, and the politicians has to take responsibility for this. Now, in terms of the kids going to school, one of the things I look at it this way. Now, if you live in the Northeast, those who have gone through, the whole big period of the pandemic and the spread and the death and all that, but you find that the number of those who or repeated cases, the decrease and all that. Yes, those people can actually sit and review how well they need to go to school, and if they need to, how. But even in those areas, I'll give you a typical example. If it's in New Jersey, um, there are places where you have more numbers of cases as compared to all the different counties. So the county where you have a higher increase rate of cases of positive coronaviruses, yes, those counties should come to terms, either to do full internet classes or to do half or partial, as they see fit. But for those who have areas where there are no reports or very minimal or few reports, yes, they can come up with the discussions where they say, what, we can open where we have the capacity and the resources to carry out with the advice and the CDC protocols that were set up, social distancing, classroom, what do you call it? Spacing and teachers and all that and all that. So, but in areas like in California or Florida, where the thing right now is they're almost still at the peak, I don't think it's a wise idea to open up, because look, in as much as we don't have these kids, they get infected. Like somebody has said, some studies come up all the time. If I like, this virus is writing its own textbook as it goes along. We're going to learn so much from it as we go on. It's impacting medicine so much more than we'll ever think. Um, Kids 10 years and lower, even if they get infected, don't spread the disease like kids 10 years and above. But that's one.
Mm-hmm.
And then the death rate in those kids is so much less as compared to older kids or adults who have multiple issues. Now the biggest concern is this: it is not just the kids per se, because kids will go out, they'll play. You can't stop them. And like somebody said, they are a petri dish of infection, and which is normal because that's the ideal thing to do, to build their immune system up, to get them ready for adulthood, and to trigger their immune system to work better for them. Now, the biggest issue is when they get infected, they may not even show it and they'll be fine. It is when they come home. Now, when they come home, they can give to grandma, they can give to grandpa, they can give to auntie, uncle, or even to mom and dad who have diabetes and all those issues. Then that's where the issue is, because no child will want to go to school, come back, bring a disease that's going to kill the parents or kill grandma and grandpa. So
Yeah.
when it comes to going back to school, like I said, those who are full blown don't make no. Personally, I don't think they should go back. They should continue to monitor and reassess, the infectious rate and see how much is dropping, and as well as do a sample actually. Probably those in the school age, those who are immune. What does that mean? You take a sample, draw blood from maybe 50% of the population,
Yeah.
and see if what percent of the population, of if you can 100%, what percent of the population have immunity to the disease.
Mm-hmm.
Like New York did one where they did 15,000 people, I think in April or so, and they found that out of 15,000, it was just about was it 15% of them who had been exposed to the virus, who had built up immunity. So that's what it is. If you have a mutant level, 45 and above, then you can begin to discuss the issue of opening up. It therefore means most of the people in the population are immune. But one of the questions when we talk about immunity, who is immune? How much immunity it is? Uh, we're still learning about it. The reason why is this: when you talk about the SARS and the MERS, the SARS and MERS when they did their immunity, status at that time when it came up, they lasted about 2 years or so for the MERS, and SARS for about 3 years.
Yes.
So, like I always say, unless this virus is from the depths of hell, then it should behave like its cousins, the SARS
Right.
and the MERS. So we should be able to build immunity that will last for another 2 to 3 years from now. So
Yes.
unless it's that, then we should be fine. So for those who have been immune, yes, you should be covered. I'm immune. I check my status, so I tell people I've been COVIDized. That's the word I use.
Oh, you're right.
COVIDized
I
that.
like that.
So I'm good, and
Mhm.
I'm fine. So for those, even when for those who live in areas where the incident rate is so low, less than 1% or two, before you send your kids to school, please ask your doctors to check their immune status, because you all may be in the same house but never got sick, but got the COVID virus. You may not even have known that. So, but before you go, check your immune status. Ask your pediatrician or your doctor to check for IgG, IgM, for the COVID-2 virus. I did for Stephanie. She came out positive. So she
Okay.
got exposed, of course, to us, but she never got sick. So until we did that, just get her ready for school, we didn't know. Well, for some reason, I knew she was exposed, but she didn't get sick. So now, and I jokingly say, Stephanie, you've been COVIDized, even if you
Yes.
get sick. So, but for them to go to school, I think they need to know their status. And
Okay.
even for those who are traveling, you need to know your status. If you've been immune, if you're traveling from a developed country like the U.S. to like in Nigeria, Ghana, or in anywhere, any developing country, please check your status so that you don't want to go onto a plane and pick up something, that when you go to a place where they have very poor or limited healthcare system, then it becomes an issue for you.
I see. Oh, thank you for sharing that. And on a final note, looking back and thinking forward, do you think we are ready, like for another probably unprecedented, out of nowhere pandemic crisis? You think we're ready, or are we getting there based on, past Spanish flu, all of them past pandemic, just like you had mentioned? So are we there yet?
Well, I'll say this one. I'm a man of faith. God is not wicked. so, so give us double dose. And listen, the Bible says He will never give you anything you can't handle. So
Right.
even if anything comes out, well, I'm sure He knows we'll be able to handle it. And I'll tell you why.
Yes.
China and those countries in Southeast Asia, and Senegal, Liberia, and all those countries, and even Nigeria, you see those numbers, the death rate is so low. People begin to ask why. Why is it like that? Most likely like that because guess what? They've been primed already. They've had the SARS, they've had the H1N1,
Mhm.
they've had epidemics consistently, so they're used to it. So it's easy for them to lock down, and the people who've gone through it understand the value of having to stay at home and then having to prepare. And not just that, the government itself will be able to prepare for them. Find ways to give them food, find ways to do stuff that will get them ready, and provide for them. I mean, look at we never did homeschooling before.
Yeah.
Now we do homeschooling. The whole lot of NGOs that are out there doing great and amazing stuff before. Now we're having that. Now look at you and I. If you had this event to happen, we have to get the chair, rent the house, rent the get the food and everything else, and invite people to come in transportation. Now we're not doing that.
Yeah.
So you find out that we're better prepared. We're better prepared, and not just that. Even your immune system is better prepared. Now a lot of people, some people were exposed to the SARS, some people were exposed to the MERS and the H1N1. And remember, there are 10 other coronaviruses that are out there that causes the cold, the common cold, and all that. So people were exposed to that, and they built immunity over it. So if we go through the SARS 2, which is COVID-19, definitely, and you survive it, you're going to build immunity against it. So even when something else comes that is SARS-like, of course, you'll be able to handle it. And we're human beings, we're resilient, and that's the way God built us. And why we're here.
Well said, Dr. Aluya. Well said. And yeah, before I wrap up, something just, actually came to my mind because you had mentioned when we're talking about the students. So in terms of probably supporting, having a support group for them, because currently I notice there's a lot of, but I don't know if it's a lot, but there are support groups, going on or being developed and implemented for the adults and nurses. Like for example, AICC currently is running a support group for nurses and other healthcare workers. So this is ongoing, twice bi-weekly. And I'm just curious, are you suggesting that, just so to make sure that we're not like neglecting the kids and assuming, oh, they're not being stressed, not minding their emotional status, or, so is this something that you think is warranted to have, like support group sessions for kids as well?
Yeah, it is. It's important, and I'll tell you this: most developed world have a tendency or knack to doing that. They form support groups, that would help share their information, share their messages,
Yes.
share their experiences, help lighten or offload their burden, and then
Yes.
share resources as well.
Yes.
And I always say resources is time,
Yeah.
money, and intellectual capacity. So all that put together, if you come in together in a group and share that, it's a lot easier to
Mhm.
handle. And you know that you're not alone going
Yes.
through what you're going through. Because most people tend to think they're alone. And unfortunately, in our community, the black, brown, and especially, African community, we tend to live in silos. We don't share, our problems because you think it's going to make you weak or people are going to laugh
Yes.
at you, But then one of the things that set us back as a race, I must say, and I'm sorry, to say that, but it's some of the things that set us back as a race, where we walk 3 steps forwards and 6 steps backwards, because we don't share. We don't share our knowledge. We don't share our time. We don't share even put money together to get anything of value that will create impact in our community. Other people are doing it, but thank God, we'll begin to come to that space now where we understand that if you live alone, you will most likely die alone. You need your community. We need value. We need everybody. I don't know where we lost it because everybody else, every other community actually learned from Africa.
Yeah.
Ubuntu, the community effort that we learned. But
Mhm.
I guess we in the process of imbibing, Western culture,
Westernized culture. Yeah.
we began to, relegate. Look, if you pick up something you don't understand well, you most likely would bastardize it. And I
Yes.
always tell people, it is okay to be civilized, but
Yeah.
you don't have to be westernized. They're two different things, and we must begin to learn that. Yes, create support groups that help one another.
Great. Dr. Aluya, thank you so much. It's been a pleasure to have you with us.
Great.
Yes, and I hope when I reach out to you, you're going to come back again.
Yeah, anytime.
Thank you, thank
Pleasure.
you, thank you. So, well, viewers, you heard it from the eye of the eye of the beholder. And just a recap, Dr. Aluya really talked on very important issue. He talked on very important points, and I hope we really got valuable information to take home, with us. And just to remember, COVID-19 is here, unfortunately, and as we're going through this readjustment, process, the healing process, we probably need to start getting used to wearing masks because probably normalcy might take a little while before might take a little while for things to get back to the way they used to be. Also, telehealth is here and probably is something we need to start readjusting to get used to. And also, one important thing Dr. Liu had touched was that, especially as kids are going back to school now, to sort of try to check, they need to check their status, their immune status. And that, that would all will be very helpful. And I'm sure, many more other things he has mentioned. But then we're running out of time, so we're going to round up here. And I thank you and looking forward to seeing you the next series, which is next week. And we are going to now have a discussion where we hear from the nurses' point of view, from the nurses' lens who were working, in the front lines. Dr. Aluya, thank you.
Thank you. My pleasure. All right.
Goodbye,
Bye bye.
viewers.
Bye bye.
Bye bye.